Vidushi Kaladhari Bhavani, who has completed her master's in psychology in Surana College, Bangalore, and she is the gold medalist for PG studies in Bangalore University. She's also completed her BA degree from NM College for Women. So she has managed to do her academics and her passion in music equally well. So Kaladhari Bhavani has, ma'am has, cleared her NET and GRF in her first attempt itself, which is a real challenge in the field of psychology. Talking about her, Kaladhari ma'am's publications, she has published a paper titled Sleep Disturbances and Life Satisfaction in Adolescence in the Indian Journal of Psychological Sciences in August 2020. And talking about her musical journey, she is a B high grade artist in All India Radio, and she's a recipient of one of the most famous MS Subbalakshmi Voice of the Year contest conducted by the Hindu and Saregamapa. Uh, she has passed Vidvat exam conducted by Karnataka Higher Secondary Examination Board with first rank distinction in both vocal and flute. She has felicitations and awards from prestigious institutions and sabhas across the state and has won over 300 prizes in various competitions. So, so we welcome our speaker, Kaladhari Bhavani. But before we move on to the uh, webinar as such, I would request all of them to switch on their cameras for a picture. Asif sir, ready now, sir?
Hello, ready, ma'am?
All participants, please switch on your camera for the photo.
Lot of disturbance with respect to one microphone. There's a lot of noise. Okay. I think it's over.
No, ma'am, it's not yet completed. So I request all the participants to switch on their cameras. Asif sir is waiting for all of you to switch on your cameras.
Let us take the photograph as it is, even if the camera is not switched on. Okay, we shall proceed with the program.
Okay, ma'am, thank you.
Thank you all. Kaladhari ma'am, the session is yours. Sorry, before that, I request Kamla ma'am to address the gathering.
Geeta,
Yes, ma'am.
Geeta, no, no, I will finish my work right now. Yeah, later on it can go on. Okay. So good morning, everybody.
Good
Madam, can
morning,
you
ma'am.
hear me?
Yes, ma'am, we are able to hear you.
Bhavani, madam.
Kaladhari ma'am, you're on mute.
Please switch on your microphone. Kaladhari Bhavani, madam. Can you hear me? Respected speaker, can you hear me? Microphone testing. Can you speak? Can you say hello? Very good morning.
Can you hear me?
Yeah, very good morning. So from Department of Psychology, National College, Jayanagara, a beautiful program.
Thank you, ma'am.
Relating.
Ma'am, the audio is breaking. Hello?
Relating music to psychology is organized, and we are extremely happy to have you here, Madam Kaladhari Bhavani, madam. So looking at your the accomplishments, you have achieved a lot at a very young age. So you have studied psychology, you have studied music, and most importantly, it is very necessary to relate music to
Hello? Hello, ma'am? Hello?
Hello, ma'am.
Audio is not
I think
proper.
I think network problem, madam.
Okay.
Kaladhari, madam. 2 minutes. We will
Yeah,
wait.
sure. Take your time, no problem.
I think, ma'am,
you can
you can proceed, madam.
Yes. ಏನಿಲ್ಲ ಎರಡು ನಿಮಿಷದಲ್ಲಿ ಮುಗಿಸ್ತೀನಿ. I was saying it is very important to relate music to different faculties, and this is one experimentation in our college where you are relating music to psychology, which is very well proved and necessary too. As we know, music is 100% science. Shruti, Laya, Tala are integrated with one another. So each one is equally important. If you miss Shruti, or if you miss Laya, or if you miss Tala, then it rather than the music, it becomes a noise. And secondly, if all the three Shruti, Laya, Tala are perfect, and if the waves are rendering in atmosphere, when it falls on your brain, it has been scientifically proved. The frontal lobe of your brain, which is important for thinking and other aspects, and the rhythms of the music will rejuvenate the neural connections. They will inspire the neural connections. So music has a role to play, definite role to play, which has been scientifically proved. So this aspect of music in its all grandeur and dimensions, Madam Kaladhari Bhavani will be explaining it to us. Madam, we are very happy to have you here.
Thank you, madam. Thank you so much.
Thank you for accepting our invitation, and over to you. and it's our pleasure to listen to you. Thank you. Thank you, Geeta and Jayant, for organizing the program. Thank you.
Our pleasure, ma'am.
Thank you, ma'am.
Good morning to one and all. First of all, I thank Geeta ma'am and also the principal ma'am for their beautiful introduction, and I'm really honored by the words of our dear principal ma'am. So I could make out the amount of knowledge, the vast knowledge that she has in the field. So I'm honored, ma'am. Thank you so much. Thanks a lot. So let's start our webinar for today. And before starting, I personally welcome you all. Yes, I will try to keep the session as interactive as possible. So I will be asking some things, some opinions, or let's discuss about certain things. Please do respond. So it's a request for all the participants. And in which language you prefer for the session to be? Like, is it English or Kannada, or is it okay if I mix both? How would you like to be?
A mixture of both is fine, ma'am.
Mixture of both? Fine. Okay. So just give me a minute so that I share my screen. Is the screen visible?
Yes, ma'am.
Okay. Fine. So let's
Ma'am.
start our music
Ma'am, could you
cycle.
please go to the PPT, ma'am? Your PPT is not visible, ma'am.
Is it not visible?
Screen is visible, ma'am. PPT is not shared.
Oh, okay.
You select on the PPT, ma'am.
Just a minute.
Yes, ma'am. Yes, ma'am.
இந்த ஸ்கிரீன் பண்ணிட்டுக்கே போச்சு உட்காந்து நீ கொத்த பண்ணி நான் பண்ணிட்டுலே வச்சிரு வச்சுட்டோ வீடியோ ஆடியோ ரெண்டு ஒன்னிட்டுலே வை Okay, for me it's showing you are presenting, but why is it not visible for you?
It's visible, screen is visible.
Screen is visible, but the PPT is also, I am presenting like it's running here, but unmute பண்ணுவானா அது சொன்னேன் மத்த
Kaladhari ma'am, you can present your PPT. You can the PPT is minimized, so if you can open that tab, it's good enough. Ma'am, the PPT is visible. You can start.
Yes. You can hear me, right?
Yes, ma'am.
Yes. Fine. So let us start our journey. And in between, if you don't see the slides changing or something like that, if you have any technical issues, do let me know so that I'll check my connection and all. So, what we're going to discuss in this entire webinar, we will
Uh,
be.
Kaladhari ma'am, so sorry to disturb you.
Yes.
I will present the screen so you can stop presenting.
Oh, okay. Fine. Yes, I have stopped.
So is the screen visible now?
Yes, yes.
Okay, ma'am, you can continue.
Okay. Whenever I have to go to the next slide, I will just say next so that you can go. So please go to the second slide. Yes. So first we will see what music is so that let's understand some basic concepts of music and the goals of music, like in Indian perspective from the point of view of India, Indian culture. And then we will be seeing the interface, the connection, the interaction where we can see the music and psychological concepts like learning, memory, emotions, all those they connect. And then we will be seeing the interaction between the human body and music and how body responds to music, everything. So and then we will be having a bird's eye view on music therapy. So what the concept is, the different techniques they use and approaches in music therapy. So and there are certain misconceptions like how we have in every field. So we'll be seeing all those things. Next slide. Music has been a part and parcel of our culture. It is not something that is, that's there now. Right from if we look at our epics, our Puranas, ಎಷ್ಟೊಂದು ಉಲ್ಲೇಖಗಳು ತುಂಬಾ ಇದೆ ಲೈಕ್ ಋಷಿಗಳು ದ ನಾರದ ತುಂಬುರು ಅಂಡ್ ಈವನ್ ನಂದಿ they were the court artists, they were the vidwans of Devaloka, Indraloka. So ಸೊ ಪುರಂದರದಾಸರು ವೆಂಕಟೇಶ್ವರನ ವರ್ಣನೆ ಮಾಡ್ತಾರೆ, ತುಂಬುರು ನಾರದ ಗಾನವಿಲೋಲಂ. ಸೊ those were the musicians. And even Nandi played mridangam for Shiva. And each god, each and every deity is associated with an instrument. Can we imagine Krishna without a flute? Can we imagine Saraswati, Mata Saraswati, without a veena on her lap? No. Yavade image nodidru we will see that flute and that veena. And Shiva is associated with dance, the cosmic dance, Tandava Nritya. So music and dance are again inseparable. They are compared to the union of Shiva and Shakti. So again, music and dance are inseparable. Shiva has Damaru and also he dances. Like that, right from the very roots of our culture, we have music and dance. We have art basically. So if we look at the concept of music, it's universal in all culture. It's ubiquitous. It's not only India, it's not only Western music. Everywhere we have music. And in India, it's called Sangeetam, which is split as Samyak Geetam. Samyak andre channagirodu, sariyagirodu. Geetam andre hadu. And if we look at the definition of music, there are a couple of words that we have to understand here. Firstly, the tone. What is a tone? A tone is a note, is a swara, it's a musical sound anta helbodu. Andre it's a note. So when we combine many notes like that, we find harmony. There should be a harmony between notes. Agle adu hard agodu. When there is harmony between two or more notes, multiple tones or notes, there comes harmony. And from that harmony, melody is born. Madhurya. Nada, we can't directly associate nada with melody. So madhurya is a better word. So when we have to say a song is melodious, ಈ ಹಾಡು ಮಧುರವಾಗಿದೆ ಅಂತ ಹೇಳಬೇಕಾದ್ರೆ, there should be a harmony between the tones. And if we consider it, we have to understand laya. Laya is the rhythm. There is laya in everything in this nature. So even if we have to see laya in nature, ಯಾವುದೋ ಒಂದು ಹಕ್ಕಿ ಕೂಗ್ತಾ ಇದೆ ಅಂದ್ರೆ ಅದು ರಿದಮಿಕ್ ಆಗಿ ಕೂಗ್ತಾ ಇರುತ್ತೆ. ಇಫ್ ಯು ಅಬ್ಸರ್ವ್, ಇಟ್ ವಿಲ್ ನಾಟ್ ಗೋ ಆಫ್ ಬೀಟ್. ದೇರ್ ಇಸ್ ಲಯ ಇನ್ ದಟ್. Our heartbeat has a laya. It has a rhythm. So here we have understood the meaning. When all this comes, when there is this expressive arrangement which is pleasing, the arrangement of tones, harmony, everything is pleasing, then it becomes music. This is how we understand music. Next slide, please. So the goals of music, it has evolved from the time immemorial. See, ಮೊದಲು ಅದರ ಗುರಿ ಏನಿತ್ತು, it was entirely different. The original purpose that was there in roots is entirely different from what we have now, from what we expect out of music now. It's entirely different. Then it was completely viewed as something divine, something that leads to moksha, oneness in God, the path of bhakti marga. Bhakti margakke adondu sadhana, it was a tool to achieve moksha. So you will be aware of stories like Dikshitar, Muthuswami Dikshitar anta, there is a great composer in Carnatic classical music. ಅವರು ಅಮೃತ ವರ್ಷಿಣಿ ರಾಗ ಹಾಡಿ ಮಳೆ ಬರೆಸ್ತಿದ್ರು. ಈ ತರ ಎಲ್ಲ ತುಂಬಾ ಸ್ಟೋರಿಗಳಿರುತ್ತೆ. ಇನ್ನೊಬ್ರು ಇವರು ತಾನ್ಸೇನ್ ಅವರ ಗುರುಗಳು, ಐ ಫರ್ಗಾಟ್ ಹಿಸ್ ನೇಮ್, ವೆನ್ ಹಿ ಸ್ಯಾಂಗ್ ದೀಪಕ ರಾಗ, ದೀಪಗಳೆಲ್ಲ ಹತ್ಕೊಳ್ತಿದ್ವಂತೆ. ಆಲ್ ದೋ ಸ್ಟೋರೀಸ್, ಅದು ನಿಜಾನ ಅಲ್ವಾ ಅದು ಬೇಡ ಈಗ, ಬಟ್ ಆ ಸ್ಟೋರೀಸ್ ಹೇಗ್ ಬಂತು, that explains the power, the spiritual powers they had. the spiritual power they believed that they had while practicing music. So music was viewed something as divine as that. And then, with the course of time, kings came into the force. So ಅಲ್ಲಿ ಹೇಗಾಯ್ತು, ಮ್ಯೂಸಿಕ್ grew under the patronage of kings. ಆಸ್ಥಾನ ವಿದ್ವಾಂಸರಿರ್ತಾ ಇದ್ರು. Their job was to entertain the king and the god, because king was also considered as god. Raja Pratyaksha Devata, he was also considered as god. That's why their music was only restricted to the king and the god. And at some point in the society, music and dance, all these art forms were the monopoly of a particular class in the society. ಎಲ್ಲ ಕ್ಲಾಸ್ ಅವರು ಎಲ್ಲ ಜನಾಂಗದವರು ಅದನ್ನು ಕಲಿತಿರ್ಲಿಲ್ಲ. It was monopolized from a particular class. They were called the court artisans. Their job was to dance, to sing, or to play instruments only only for the king, the queen, and god. ಹೀಗೆ ಆಗ್ತಾ ಆಗ್ತಾ it developed in such a way that slowly it started spreading to the population, to the normal people, the common population, where everyone started learning. So here, different musicians came out. They started learning instruments, singing, everything. So composers also came in. They composed kritis. And slowly, the concepts of aesthetic and environment came into existence. But now, if we see, the scenario is completely different. Now, music is a profession. It's a career option within which there are many professions. Within this field of music itself, you have composers, you have music directors, you have lyric writers, you have producers, you have organizers, whatnot. Earlier, music was not at all used for livelihood. The vidwans never earned their livelihood out of music. It was considered as some sin. ಕಲೆಯಿಂದ ದುಡಿತಿದ್ದಾರೆ ಅಂದ್ರೆ ಇದೊಂದು ಪಾಪ ಅನ್ನೋ ಹಾಗಿತ್ತು. But now it's not like that. Now it's a profession. It's a livelihood for many. And if we look at the goals, of course, music has therapeutic values, and it was recognized also. And if we look at the difference, there is a whole lot of difference between the goal of music for a musician and for a therapist. For a musician, the goal is to take people along with him to that bhakti marga or whatever. But for a therapist, it's not. For a therapist, the goal is to apply his expertise in music, to apply music, to use music to treat some symptoms, to treat a disorder. So the expectation is also different. So if you look at music courses and music therapy courses, you will find the difference in the syllabus itself. The goals are different. That's why. Next slide. So comes to our topic, linking music and psychology. So how do you link? Can someone answer? Someone give some perspective about this? Fine.
Can I, ma'am?
Yes, sure.
It's about expressing the feelings or emotions towards the music.
Very good. Yes. So let us look at each concept, how music is related to each psychological phenomena. If we take learning, let me start with a story. So tumba hinde, somewhere, I don't know, like in which year I don't know exactly, in Kerala, in medical college of Kerala, there was this professor who used to handle anatomy classes. Every day, slowly his attendance got terribly decreased, and people never used to attend his class. So the bunking behavior was extreme. ಬರ್ತಾ ಏನಾಯ್ತು ಅಂದ್ರೆ and hardly there were two people, three people in the class. And Auru, they were, dozing off, sleeping. He thought, what is going wrong? ಎಲ್ಲಿ ಏನಾಗ್ತಾ ಇದೆ? So he thought, let me start something new. Let me improvise. So in one class, what he did was, to the two or three people itself, he started teaching with music, like kidney, liver, this is kidney, this is liver, like that. In a musical way, he started teaching. Slowly, his attendance started increasing. By 2 or 3 days, he got 50% attendance, and by another week, he got 100%. And eventually, the students also started replying to him, answering him with that same tone, same tune, like musical. So this incident, it led to the whole new strategy of teaching called teaching through music. So all other professors also started incorporating this. So why I said this is, we have some inherent capacity to learn something musical, learn things in a musical way. I am sure you wouldn't have learnt, none of you wouldn't have learnt tables like 2 ones are 2, 2 twos are 4, 2 threes are 6, and yaru heliralla. 2 ones are 2, 2 twos are 4. It was in the same tune. And Sanskrit students will be knowing this. If we have to say by heart Shabda, Rama Shabda and all that, we used to follow a tune in that. Even if you have to say one simple shloka, you need not go to Veda mantra. Adala beda. Simple shloka. Vakratunda Mahakaya helbeku. Vakratunda Mahakaya antane hoguttadu. Right? So we have something inherent. Our brains are trained to respond well, to learn well when we teach it in a musical way. Even children learn rhymes in a musical way. Sumne twinkle, twinkle, little star, how I wonder what you are. Anta helidre ಏನು attraction sigalla. You just call a child and say like that, twinkle, twinkle, little star, how I wonder what you are. It's a ತಪ್ಪು ಹೇಳ್ತಾ ಇದೆಯಾ ನೀನು. Twinkle, twinkle, little star, ಹಾಗೆ ಹೇಳಬೇಕು. So why is that? Here comes the relationship between music and learning. And learning and memory are again so much interrelated. You will be knowing that. So music involves all the aspects of memory, all types of memory. If we take declarative memory, what does declarative memory has? Declarative memory has all facts, words, everything. So here comes Sahitya. We remember facts about music. We remember the trained musicians will be remembering so many compositions. Any trained musician, a performing artist, will be having at least 1,000 composition in his database. So declarative memory comes here. Episodic memory, we will remember what happened when we learned that. Or if you listen to a song, you will get the images, you will remember all the episodes related to that song. Mungaru Male film you need not see again and again. Mungaru Malege haad kelidre you will remember. You will remember the entire story. So here comes the episodic memory. Like that, the memory, the neurons that store information are strengthened. That's why if you observe, it's rare. I don't say it's not at all there, but it's rare that musicians do suffer from Alzheimer's. They don't, because their neurons are in regular use. Alzheimer's is a neurodegenerative disease. Why it develops? Because we are not using our neurons that we are storing information with. That gradually fades. So this doesn't happen with musicians. Even the skills, even the instrument players, They remember how to play, what is the fingering of their instruments, right? So here comes the relationship between music learning and memory. This emotions, it's before I talk about this emotions, feeling, mood, let me demonstrate something. Were you able to hear the audio clip?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
So, someone, a few of you, please tell what you felt. How you felt.
Pleasant.
Okay, then?
Can I say?
Yes?
I feel the vibration of the waves of this kind of music, which it has. So it affects on each one of the neurons. So in a way that it affects the feelings and emotions,
Yes.
and through the waves of that energy,
Yes.
it could be something like that.
So, each raga has an emotion, rasa. Here comes the concept of navarasa. We have 9 rasas. Apart from that 9, we have many other rasas, many other emotions. The 9 main rasas are like Sringara, Hasya, Karuna, Raudra, Veera, Bhayanaka, Bhibhatsa, Adbhuta, Shanta. So, in each raga, the rasa is the essence of the raga. If you want to understand this, it's the best you have to observe, just observe the background music that you will get in films and serials. Huh? Sorry? Someone said something? Okay. So, my grandmom, she just switched on TVC. It was on some channel. She watches a mega serial. So she just switched on that serial and she was cooking inside. I asked, ಏನಜ್ಜಿ ಸೀರಿಯಲ್ ಹಾಕ್ಬಿಟ್ಟು ಬಂದ್ಬಿಟ್ಟಿದ್ದೀರಾ ನೋಡಲ್ವಾ ಅಂತ. ಅವ್ರು ಎಂದ್ರು, ಅಯ್ಯೋ ಅದ್ರಲ್ಲಿ ಏನಾಗುತ್ತಮ್ಮ, ಅವಳು ಇನ್ನೂ ಅಳ್ತಾ ಇದ್ದಾಳೆ, ಆ ಮ್ಯೂಸಿಕ್ ನಂಗೆ ಗೊತ್ತಾಗ್ತಿದೆಯಲ್ಲ, ಅಳ್ತಾ ಇದ್ದಾಳೆ, ಅದೇನಾದ್ರೂ ಮುಂದುವರಿತು ಅಂದ್ರೆ ಆ ಡಮ್ ಮ್ಯೂಸಿಕ್ ಬರುತ್ತೆ, ಆವಾಗ ಹೋಗಿ ನೋಡ್ತೀನಿ ಏನಾಯ್ತು ಅಂತ. ಸೊ ದಟ್ ಪರ್ಸೆಪ್ಷನ್ it's something inherent. See, everyone, whether you're a trained musician or you're not a musician, you know about music or you don't know about music, you can perceive some emotion, some rasa in a raga. It's not just a raga in a composition, in a piece of music. But we should also at the same time remember that each raga can elicit multiple emotions. It's not that ಇವಾಗ ನಾನು ನಿಮಗೆ ಕೇಳಿಸಿದ್ದು ಇಟ್ಸ್ ಕಾಲ್ಡ್ ಕಾಪಿ. The name of that raga is kapi. So kapi need not elicit calmness always, or it need not elicit the emotion of bhakti always. So each raga has the capacity to elicit, to express multiple emotion, and each emotion has the capacity to be expressed by multiple ragas. So it is not that happiness can be expressed only if we use mohana. No. So there can be multiple emotions and multiple ragas. It's vice versa. So what is actually, if we look at the songs, we can see the influence of lyrics in that emotion. Raga is not alone important because we have lyrics, we have the sahitya part in that. If we take the simple film songs also, Vande Ragdali, they would have given multiple shades. We will be perceiving the emotions based on the raga, on the tune, on the lyrics, on the instruments that are used, and also based on the situation in which that song comes. So this music and emotions are related, not now, it's related tumba hindeinda. When I was listening to a lecture video, that lady was giving a very beautiful phrase. When words can't speak, music speaks. So when there is the extremeness of this emotion, if we can't express that emotion through words, then we can go for music. That's what they do in music therapy, in one of the techniques. So simple. See, in film, you can just say, the hero can just say, I love you. But it doesn't stop there. There is a song there. Why that song comes? That if we take Saint Tyagaraja's composition, the bhakti towards Rama doesn't end there. He can just say, Ayo, bhakti, Rama, my favorite, my Rama. He can say hundreds of words, but Teliyaleru Rama Bhakti Magamunu, that one line, it depicts that emotion. So composers, in a way, all the Bhagyakaras, you take Purandara Dasa, you take Kanakadasa, everyone, they used their compositions, they composed to express their feelings, to express their emotions. That's why they composed. That's why you can see the bhava in their compositions, the situation, the emotional states in which they were, you can see. Because in one single raga, there will be multiple compositions by multiple composers. So each composer views that raga, uses that raga in his composition with an emotion, with an emotional state in which he was while he was composing. So even if we take mood, again, this mood is the same thing, like it has the same explanation. Each raga has a mood, of course. Each instrument also has a mood for that matter. ನೀವು ಎಲ್ಲೇ ಇರಿ, ಯಾವುದೇ ಸಿಚುಯೇಷನ್ ಆಗಿದ್ರು, ನಾದಸ್ವರ ಕೇಳಿದ ತಕ್ಷಣ, ನಾದಸ್ವರ ವೋಲ್ಗ ಅಂತೀವಲ್ಲ, ನಾದಸ್ವರ ಕೇಳಿದ ತಕ್ಷಣ ವಾಟ್ ಫೀಲಿಂಗ್ ವಾಟ್ ಮೂಡ್ ಯು ವಿಲ್ ಗೆಟ್? You will go into the mood of celebration, function, marriage, something auspicious, something good. ನಾದಸ್ವರ ಕೇಳಿದ್ರೆ ಯೂಶಲಿ ಅಳಬೇಕು ಅನ್ಸಲ್ಲ ಯಾರಿಗೂ, ಅಳೋ ಮೂಡ್ ಬರಲ್ಲ. So instrument has the tone of the instrument itself is like that. It's associated with that. And this lullabies, lali hadgalu, it's usually lalis are composed in a raga called Neelambari. ನೀಲಾಂಬರಿ ಅಂತ ಒಂದು ರಾಗ ಇದೆ, ಅದ್ರಲ್ಲಿ ಕಂಪೋಸ್ ಮಾಡಿರ್ತಾರೆ ಲಾಲಿಗಳು. ಸೊ ಅದೊಂಥರ ಲಾಲಿ ಎಫೆಕ್ಟ್ ಬರುತ್ತೆ, ದಟ್ ಡೋಸಿಂಗ್ ಆಫ್ ಎಫೆಕ್ಟ್. You will go into that mood. But again, the situation in which the piece of music is composed again depends. Simple example, the what I played now, Kapi Raga, same ragadalli ಪುರಂದರದಾಸ ಮಾಡಿದ್ದಾರೆ, ಜಗದೋದ್ಧಾರನ ಆಡಿಸಿದಳೆ ಶೋದೆ. ಆ ಮೂಡ್ಗೂ ಸಭೆಯೊಳಗೆ ದ್ರೌಪದಿಯ ಸೀರೆಯನು ಸೆಳೆವಾಗ ಎಲ್ಲಿ ಅಡಗಿತ್ತೋ ಈ ನಿನ್ನ ಶೌರ್ಯ. See the difference. There is definitely difference. ಸಭೆಯೊಳಗೆ ದ್ರೌಪದಿಯ ಸೀರೆಯನ್ನು ಇಟ್ಸ್ ಇನ್ ಅ ಸರ್ಕ್ಯಾಸ್ಟಿಕ್ ಮೋಡ್. ಹಿ ಈಸ್ ಆಸ್ಕಿಂಗ್ ಹಿಮ್, ಆಗ ಎಲ್ಲ ಹೋಗಿತ್ತು, ಈಗ ಇಷ್ಟೊಂದು ಕೊಚ್ಕೋತಾ ಇದೆಯಲ್ಲ, ಆವಾಗೆಲ್ಲಪ್ಪ ಹೋಗಿತ್ತು ನಿನ್ ಶೌರ್ಯ, ನನ್ ಶೌರ್ಯ ನೋಡಿ ಇವಾಗ್ಲೂ ಇದೆ. ಸೊ ಬಟ್ ಹಿಯರ್ ಜಗದೋದ್ಧಾರನ ಆಡಿಸಿದಳೆ ಶೋಧೆ, ದೇರ್ ಇಸ್ ಅ ಕ್ಯೂಟ್ನೆಸ್ ಇನ್ ದಟ್. ಯು ವಿಲ್ ಗೆಟ್ ದಟ್ ಇಮೇಜ್ ಆಫ್ ಕೃಷ್ಣ. ಸೊ ದ ಮೂಡ್ ಇನ್ ವಿಚ್ ಬೋತ್ ಆರ್ ಪ್ರೆಸೆಂಟೆಡ್ is entirely different. Raga is the same. So when we say that this piece of music is eliciting this mood, this emotion, this feeling, we have to keep all these things in mind when we say that. I will demonstrate with an example. ಯಾವ ಮೂಡಲ್ಲಿ ಇತ್ತು this bit according to you?
Joyous.
Sorry?
Joyous.
Joy. Okay. Now I'll play another one. ಇದು ಯಾವ ಮೂಡಲ್ಲಿ ಇತ್ತು?
Patho.
Progressive patho.
Okay. Did you observe that both the audio bits were in the same raga? It's called jog. The first one was played by guitar and the second was in sarangi. So the tone of guitar usually doesn't bring you much to patho or sad mode. The tone of instrument itself is like that. And sarangi tone irode hage, it's like very, pathos, sad, something like that. So uh, if some minister or somebody is dead, you will, if you have ever switched on a radio, ಟಿವಿನಲ್ಲೆಲ್ಲ ಬರಲ್ಲ, ಅದು ರೇಡಿಯೋದಲ್ಲಿ ಬರ್ತಿತ್ತು ಅವಾಗೆಲ್ಲ. ಯಾರಾದ್ರೂ ಸತ್ರೆ ಮಿನಿಸ್ಟರ್ಗಳು, ಪ್ರೆಸಿಡೆಂಟ್ಗಳೆಲ್ಲ, ಇನ್ ಆಲ್ ಸ್ಟೇಷನ್ಸ್ ದೇ ಯೂಸ್ ಟು ಪ್ಲೇ ದಿಸ್ ಸಾರಂಗಿ. ಯಾವುದೋ ಒಂದು ರಾಗ ಹಾಕೊಂಡು ಪ್ಲೇ ಮಾಡೋರು. ಸೊ ಪ್ಯಾಥೋ ಇಟ್ ಯೂಸ್ ಟು ಬಿ. So they don't use guitar in this occasion. See, the raga is again the same, but the emotion is different. So here we can see the connection, how music is connected to emotions, feelings. And this language explanation also I have already given, because I already told you that language of the composition or of the musical piece that we are listening to or that we are singing plays a role in what we feel. So usually what happens is that if we are performing in a marriage hall for a reception, just imagine that I am giving a reception concert. I will not go sing there Venkata this Innu Dayabarade Dasana Mele. ಏನು ಮಾಡಿದರೇನೋ ಪ್ರಾಣನಿಂದನೋ ಸ್ವಾಮಿ. I can't sing that. That is not the occasion to sing that. See, the music is good, the tune is good, but the language part. So again, Sangeeta and Sahitya, it's called Dhatu and Matu. They are again inseparable. You can't enjoy Sangeeta without Sahitya, and you can't enjoy Sahitya without Sangeetam. It's difficult. And all this mood, emotion, everything, it's depicted through that language. And studies have also proved that children, those who had exposure to music in their early childhood, in their infancy, they had better language development. Like they crossed the milestones of the language development earlier than other children. Why? Because they get exposed to so many words. Their vocabulary expands. So once you learn, for example, if you are learning Carnatic classical, you will be having compositions of Sanskrit, Kannada, Telugu, Tamil. So if you want to understand and sing, you have to learn all those languages, na? So you will become multilingual. And people also, the studies also say that music itself is a language. See, our brain doesn't store language as it is, like information as it is. So if I'm reading something in English, brain is not storing the information in English. Kannadalli ಹೇಳಿದ್ರೆ ಕನ್ನಡದಲ್ಲಿ ಸ್ಟೋರ್ ಆಗಲ್ಲ ಅದು. It gets stored in the language which brain knows, which the brain can code. It's a coded language, encrypted language kind of thing. So in that case, music itself is a coded language. It's a language which the brain understands, which the brain stores. And music and happiness is like it's the first thing that everyone says. You might have seen many people ಚೆನ್ನಾಗಿ ಹಾಡ್ತಾರೆ, ಚೆನ್ನಾಗಿ ಕಲ್ತಿರ್ತಾರೆ, ಬಟ್ ನೀವು ಕೇಳಿದ್ರೆ ಅವ್ರು ಹೇಳ್ತಾರೆ, ನಾನು ಸಂಗೀತ ಕಲ್ತಿದ್ರೆ ನನ್ನ ಸಂತೋಷಕ್ಕೋಸ್ಕರ ಕಲಿತೀನಿ, ಏನೋ ನನ್ನ ಸಂತೋಷಕ್ಕೋಸ್ಕರ ನಾನು ಹಾಡ್ಕೊತೀನಿ ಅಂತಾರೆ, ನನ್ನ ತೃಪ್ತಿಗೋಸ್ಕರ ಹಾಡ್ಕೊತೀನಿ ಅಂತಾರೆ. ಸೊ music, it gives a kind of happiness, satisfaction. If you attend a concert or a musical night of your favorite artist, whoever it may be, of your favorite artist, that 2 hours you will forget all the worries, everything in your life, and you spend time there, and you come with a note of satisfaction, with a kind of satisfaction with you, right? So it's music and satisfaction. And this concept of self, there are studies that indicate music helps in self-expression. Yes, it's actually true. Like how I said, the composers express themselves through their compositions. Even they make us to do in music therapy. In music therapy, what they do is that they ask the client, the patient, to compose their own songs so that their hidden thoughts, whatever they want to express. Usually, people with low self esteem, they don't express themselves. They have some hidden complexes, inferiority complex. So, they don't usually express. There are many people like that. So, for them, what they do is they make them compose music or to write a song so that they come to know what their self is. They express themselves through this music, their piece of music. Next slide, please. Um, so this music and the human body, how the body responds to music. There is one saying, Shishurveti Oshurveti Veti Gana Rasam Pani. Be it a baby or animal, anything on this earth, it responds to music. And yes, it's true. So, how the body responds to music? Again, the concept of rhythm comes, perception of rhythm. Let's do a small activity for this. I will clap. I will start clapping, and you can keep yourselves muted, no problem. You just clap along with me from where you are. Let's start. So, did you clap? Like, were you conscious? Were you like, oh, ma'am, will repeat this clap again in this many seconds? Did you think like that, or was it involuntary? It was involuntary, right? So, your brain is pursuing the distance, the distance between one beat and another. So, that is the perception of rhythm. You will perceive rhythm in each and everything in the same way. You will know, like if I repeat the beat twice or thrice, you will know when will the fourth beat come, because your brain has already perceived the distance between, the time gap between those beats. And as I said earlier, our heartbeat has a rhythm. It will not go off beat. ಯಾವುದೋ ಒಂದು ರಿದಮ್ ಅಲ್ಲಿ ಇದ್ರೆ ಅದು ಹೈ ಬಿ ಪಿ ಆದ್ರೆ ಅದು ಜಾಸ್ತಿ, ಈವನ್ ಇಫ್ ಇಟ್ ಇಸ್ ಬೀಟಿಂಗ್ ಫಾಸ್ಟ್, ಇಟ್ ವಿಲ್ ಮೇಂಟೈನ್ ದಟ್ ಟೆಂಪೋ, ಇಟ್ ವಿಲ್ ನಾಟ್ ಗೋ ಆಫ್ ಬೀಟ್. ಒಂದೊಂದ್ಸಲ ಒಂದೊಂದ್ ತರ ಮಾಡಲ್ಲ. ಅಂಡ್ ದಿಸ್ ಪ್ರಿನ್ಸಿಪಲ್ಸ್ ದೇ ಯೂಸ್ ಇನ್ ಇಂಪ್ರೂವಿಂಗ್ ಗೇಟ್ ಆಸ್ ವೆಲ್. ಗೇಟ್ ಇಸ್ ನಾವು ನಡೆಯೋ ಗತಿ ಅಂತ ಹೇಳ್ತೀವಿ. See, if you can just experiment it by yourselves after this session. ಯಾವ್ದಾದ್ರೂ ಮ್ಯೂಸಿಕ್ ಪ್ಲೇ ಆಗ್ತಾ ಇದ್ರೆ, ಎಸ್ಪೆಷಲಿ ಇಫ್ ಇಟ್ ಇಸ್ ರಿಲೇಟೆಡ್ ಟು ಸಮ್ ಪರ್ಕಷನ್, ಇಫ್ ಇಟ್ ಹ್ಯಾಸ್ ಡ್ರಮ್ಸ್ ಆರ್ ಮೃದಂಗಮ್ ಆರ್ ತಬಲಾ, ಸಮಥಿಂಗ್ ಲೈಕ್ ದಟ್ ಇನ್ ಇಟ್, you will start walking without your conscious attempt. You will start walking to match its rhythm. ಆ ರಿದಮ್ ಅದು ಏನ್ ಬರ್ತಿದ್ಯೋ ಅದಕ್ಕೆ ನಾವು ಮ್ಯಾಚ್ ಮಾಡಕ್ ಹೋಗ್ತಾ ಇರ್ತೀವಿ. ವಿತೌಟ್ ಆರ್ ಕಾನ್ಶಿಯಸ್ ಎಫರ್ಟ್ we will do that. Why? We want to maintain a balance with that. So what happens with that is, we want to maintain balance and we will start walking with it. ಅದಕ್ಕೆ ಡ್ಯಾನ್ಸ್ ಕೂಡ ಅಷ್ಟೇ. ಡ್ಯಾನ್ಸು ಆಫ್ ಬೀಟ್ ಯೂಶಲಿ ಮಾಡಲ್ಲ. ಯಾಕೆ ಮಾಡಲ್ಲ? ಬಿಕಾಸ್ ದೇ ವಾಂಟ್ ಟು ದೇ ವಿಲ್ ಬಿ ಪೇಸಿಂಗ್ ಅಪ್ ಟು ಮ್ಯಾಚ್ ದಟ್ ರಿದಮ್ ಆಫ್ ದಟ್ ಸಾಂಗ್ ಆರ್ ವಾಟ್ ಎವರ್. So they will apply this for therapy, for rehabilitation. When all this physiotherapy and all is done, ಕೆಲವು conditions ಅಲ್ಲಿ their gait would have been affected. Let's say the person has recovered from fracture, limb fracture, ಕಾಲು ಫ್ರಾಕ್ಚರ್ ಆಗಿದ್ದು. ಸೊ ಅದು ವಾಪಸ್ ರಿಕವರ್ ಆದ್ಮೇಲೆ ನಡೆಯೋದು ಸ್ವಲ್ಪ ಸ್ಲೋ ಆಗಿರುತ್ತೆ ಗೇಟ್. ಅದೇನ್ ಮಾಡಿದ್ರು ಸರಿ ಹೋಗ್ತಾ ಇರಲ್ಲ. And if you just keep on telling that person, he will not listen to you. And conscious effort in that ಮಾಡೋದು ಸ್ವಲ್ಪ ಕಷ್ಟ. So what they do is that they will give targets. ಈ ರಿದಮ್ನ ಪ್ಲೇ ಮಾಡ್ಬಿಡ್ತಾರೆ ಅವರು. They need not even give targets. ಅವರಾಗ ಅವರೇ they will start increasing the gait. ಹಾಗೆ ಆಗಿ it works. So it's currently in practice actually. They use it. And there is this autonomic nervous system. Basically, we have two central nervous system and peripheral nervous system. In that, we have autonomic nervous system as well. In autonomic nervous system, we again have two divisions called sympathetic nervous system and parasympathetic nervous system. This sympathetic nervous system, it is responsible for the fight or flight reaction. When that nervous system is activated, you will be having all like this rapid heartbeat, your pupils will be dilated, the digestion process will increase, the intestinal process will, and you feel that the blood is draining. All those things will happen. ಏನೋ ಒಂದು ಟೆನ್ಷನ್ ಆದಾಗ you will start running then your sympathetic nervous system is activated. So if you want to relax, then your parasympathetic nervous systems need to be activated. You can't relax unless your parasympathetic nervous system gets activated. That activation is triggered by music. If you listen to your favorite music or some soothing, some calm raga or something, it relaxes, it induces relaxation, so that your parasympathetic nervous system gets activated and your body can relax. And this is why it helps in maintaining homeostasis. Homeostasis is a balanced condition. It's a condition of where the body is in its balance. So that happens when you listen or when you perform. Usually when you listen, that happens then more than you perform. Because if you have stage fear, if the sympathetic nervous system gets activated, until that fear is gone. And there are these neurotransmitters called serotonin and dopamine. They are called the pleasure hormones also. They release when the body has an anticipation of some pleasure or some reward, or even when you experience actual reward. Even namuk bekadava yaradru bandrenu nam munde that dopamine gets released, serotonin gets released anta heltare. They are called feel good hormones. So that is released when you listen to your favorite song. ಇರುತ್ತೆ, ಎಷ್ಟೊಂದು ಜನಕ್ಕೆ ಇರುತ್ತೆ ಫೇವ್ರೆಟ್, ಅವ್ರ ಫೇವ್ರೆಟ್ ಸಾಂಗ್ಗಳು. ಅದನ್ನ ಕೇಳಿದ್ರೇನೆ ಅವ್ರಿಗೊಂಥರ ದಟ್ ಫೀಲಿಂಗ್ ವಿಲ್ ಕಮ್. So that those neurotransmitters are released. Next slide, please. And if we have to see the relationship between music and the brain, already the principal madam, she has told things about that. I was very happy to listen to that. So it basically our cerebral cortex has 4 lobes. 4 ಲೋಬ್ಗಳಿವೆ: ಫ್ರಾಂಟಲ್ ಲೋಬ್, parietal lobe, occipital lobe and temporal lobe. You will be knowing this, most of you. So ಯಾವ್ದಾದ್ರು when we listen to music, ಯಾವ್ಯಾವ ಲೋಬಗಳು ಏನೇನ್ ಮಾಡುತ್ತೆ? The frontal lobe is there, no? It is analyzing the music. Andre it is supplying all the data, all the information related to that piece of music. ಏನೇನು, ಯಾರು ಹಾಡ್ತಿದ್ದಾರೆ, which song is this, which instrument is this, which raga is this, or which film's song is this, which hero has acted in this, ಅಥವಾ to which god is this song related to. All the information, is this song good or not, ಇದು ಚೆನ್ನಾಗಿದ್ಯಾ ಚೆನ್ನಾಗಿಲ್ವಾ ಕೇಳಕ್ಕೆ, all this information, it is processed in the frontal lobe, all the cognitive processes related to music. And this parietal lobe, this lobe is active when we perform actually. Suppose I'm playing flute, this parietal lobe is the one that supplies information like, have I kept the flute correctly? Is my flute placed on the lip properly? Which fingers I am using to play which notes? Is it coming out correctly? All these things. The activities related. If you are playing violin, on which string your hand is in? ಕೈ ಯಾವ ಸ್ಟ್ರಿಂಗ್ ಮೇಲೆ ಇದೆ ಇವಾಗ, ಅದರಿಂದ ನೆಕ್ಸ್ಟ್ ಸ್ಟ್ರಿಂಗ್ಗೆ ಹೇಗೆ ಹೋಗೋದು? All this is done by parietal lobe. Then comes this occipital lobe. Long back, I had a friend, way back in PU, when I was in PU, I had a friend. She used to tell me, she had a breakup recently. ಸೊ ಅದ್ಯಾವುದೋ ಒಂದು ಹಾಡಿತ್ತು, ಶಿ ಯೂಸ್ ಟು ಟೆಲ್, ಕಲಾ ಆ ಸಾಂಗ್ನ ನೀನು ಪ್ಲೇ ಮಾಡಬೇಡ, ನನಗೆ ಬ್ರೇಕಪ್ ಆಗಿದ್ದು ನೆನಪಾಗುತ್ತೆ, ಐ ವಿಲ್ ರಿಮೆಂಬರ್ ದಟ್ ಗೈ, ಐ ರಿಮೆಂಬರ್ ಆಲ್ ದ ಟೈಮ್ ಸ್ಪೆಂಟ್ ವಿತ್ ಹಿಮ್, ಆಲ್ ದ ಗುಡ್ ಮೆಮೊರೀಸ್, ಎವ್ರಿಥಿಂಗ್. ತುಂಬಾ ಬೇಜಾರಾಗುತ್ತೆ ನನಗೆ, ಡೋಂಟ್ ಪ್ಲೇ ದಟ್ ಸಾಂಗ್, ಶಿ ಯೂಸ್ ಟು ಸೇ. ವೈ ಬಿಕಾಸ್ ಶಿ ಯೂಸ್ ಟು ಗೆಟ್ ಆಲ್ ದೋಸ್ ಇಮೇಜಸ್. when you close your eyes and listen to some a song, whatever it is, ಅದು ಕಣ್ಮುಂದೆ ಹಾದು ಹೋಗೋದು ಅಂತಾರಲ್ಲ, that happens, the images will come. So that visual images or pictures, whatever, that picturization, that imagination, that is done by this occipital lobe. So that is the visual cortex. So occipital lobe al agutte. And of course this temporal lobe, everything that has to do with audition, that auditory things is processed in this temporal lobe. Without temporal lobe, it's very difficult if you're a musician. So we can't process music because we can't process sounds. So temporal lobe is the one that processes all sounds, tune, everything. And there beneath the cortex, there is one thing called, there is an area of the brain called limbic system, which contains amygdala and hippocampus. So, limbic system, it's called as the seat of emotions and memory. Here what happens, this emotions, which are again, as I told, hege emotions elicit agutte anta ನಾವು ನೋಡಿದ್ವಿ. All those work is done by, all those signals are sent by, processed by, everything is by limbic system. That happens in limbic system. And when we listen to music or when we perform to our satisfaction, there is this nucleus accumbens, which is called as the pleasure center or reward center of the brain, that is activated. Next slide, please. So, yes. How pain is processed is that when ಒಂದು ಜಾಗದಲ್ಲಿ ಏನಾದರೂ ಪೆಟ್ಟಾದ್ರೆ, ಇಂಜುರಿ ಆದರೆ, ಏನಾದರೂ ಆದರೆ, the pain signals, they travel from the part where the injury or pain is caused to the brain, and the brain processes and tells the body, ನೋವ್ತಾ ಇದೆ, pain ಆಗ್ತಾ ಇದೆ ಅಂತ. So what they say is, these studies, these pain signals are blocked when we listen to music anta. And usually what happens, to block these pain signals only, we give painkillers. They are called analgesics. Analgesia is pain relief. So analgesics ಕೊಡ್ತಾರೆ. And to block these pain signals. and this purpose is also served by music ಅಂತ ಹೇಳ್ತಾರೆ. There were these two people, Muthu Raman and Krishna Kumar. They conducted a study. They were in a hospital. They selected a few patients, some in experimental group and some in control group. Assign ಮಾಡಿದ್ರು. ಒಂದು ಗ್ರೂಪ್ಗೆ ಎಕ್ಸ್ಪೆರಿಮೆಂಟಲ್ ಗ್ರೂಪ್ಗೆ ಏನು ಮಾಡಿದ್ರು, ದೇ ಆಲ್ ಹ್ಯಾಡ್ ಅಡ್ಮಿಟೆಡ್ ಟು ದ ಹಾಸ್ಪಿಟಲ್ ಫಾರ್ ಸಮ್ ಸರ್ಜರಿ. ಸೊ ಸರ್ಜರಿ ಅನ್ನೋ ಸಮ್ ಮೆಡಿಕಲ್ ಪ್ರೊಸೀಜರ್. ಸೊ ಅವ್ರು ಏನು ಮಾಡಿದ್ರು, ಟು ದಟ್ ಎಕ್ಸ್ಪೆರಿಮೆಂಟಲ್ ಗ್ರೂಪ್, ಫ್ರಮ್ ದ ಡೇ ಆಫ್ ದೇರ್ ಅಡ್ಮಿಷನ್ ಟು ದ ಹಾಸ್ಪಿಟಲ್ ಟಿಲ್ ದೇ ವರ್ ಡಿಸ್ಚಾರ್ಜ್, ಅವ್ರಿಗೆ ಕೇಳಿಸಿದ್ರು. ದೇರ್ ಇಸ್ ಒನ್ ರಾಗ ಕಾಲ್ಡ್ ಆನಂದ ಭೈರವಿ ಅಂತ ರಾಗ ಇದೆ. ಇಟ್ಸ್ ಅ ಕರ್ನಾಟಿಕ್ ಕ್ಲಾಸಿಕಲ್ ರಾಗ. ಅದನ್ನು ಕೇಳಿಸಿದ್ರು. ಎವ್ರಿ ಡೇ ಅದು ಬ್ಯಾಕ್ ಗ್ರೌಂಡ್ ಅಲ್ಲಿ ಅದ್ರ ಪಾಡ್ಗೆ ಬರ್ತಾ ಇರೋದು, ಈವನ್ ಡ್ಯೂರಿಂಗ್ ದ ಪ್ರೊಸೀಜರ್. ಈ ಅನದರ್ ಗ್ರೂಪ್, ಇನ್ನೊಂದು ಗ್ರೂಪ್ ಇತ್ತಲ್ಲ, ಅದಕ್ಕೇನು ಇಲ್ಲ. ಇಟ್ ವಾಸ್ ಕಂಟ್ರೋಲ್ ಗ್ರೂಪ್, ಸೊ ಇಟ್ ವಾಸ್ ನಾಟ್ ಅಂಡರ್ ಎನಿ ಟ್ರೀಟ್ಮೆಂಟ್. ಅವ್ರ ಪಾಡ್ಗೆ ಅವ್ರು ಬಂದು ಮಾಡಿಸ್ಕೊಂಡು ಹೋದ್ರು. ಸೊ ದೇರ್ ವಾಸ್ ದಿಸ್ ಅಬ್ಸರ್ವೇಷನ್ ಚಾರ್ಟ್ in each patient's room to check the level of their analgesics consumption. ಎಷ್ಟು ಪೇನ್ ಕಿಲ್ಲರ್ಸ್ ಅವ್ರಿಗೆ ಬೇಕಾಯಿತು ಅಂತ ನೋಡೋಕ್ಕೆ. ಆ್ಯಂಡ್ ದೇ ನೋಟೆಡ್ ದ್ಯಾಟ್, ದೇ ರಿಪೋರ್ಟೆಡ್ ದ್ಯಾಟ್ ದೀಸ್ ಎಕ್ಸ್ಪೆರಿಮೆಂಟಲ್ ಗ್ರೂಪಲ್ಲಿ ಇದ್ರಲ್ಲ, ಅವರು they didn't require as much analgesics as the others in the control group. So they concluded that this Ananda Bhairavi Raga idella, it helps in pain management anta. See, it can't cure pain. I will clear that here only. Curing is something different. Curing alla agala, but it can definitely manage that pain. So similar studies have been conducted by many. Like they have conducted it for this dental procedures iruttalla. ಅದಕ್ಕೆ ಈ ಕೆಲವು ಡೆಂಟಲ್ ಇದರಲ್ಲಿ ಸರ್ಜಿಕಲ್ ಸೆಂಟರ್ಸ್ ಮತ್ತೆ ಡೆಂಟಿಸ್ಟ್ಗಳ ಹತ್ರ ಅಂಡ್ ಈವನ್ ಇನ್ ಸಮ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಯು ವಿಲ್ ಸಿ ಬ್ಯಾಕ್ ಗ್ರೌಂಡ್ ಅಲ್ಲಿ ಏನೋ ಮ್ಯೂಸಿಕ್ ಓಡ್ತಾ ಇರುತ್ತೆ. ದ ಪರ್ಪಸ್ ಇಸ್ ದಿಸ್. ಮೇ ಬಿ ಅದು ಮ್ಯೂಸಿಕ್ ಇಂದ ಅದೇನೋ ಆಗಿ ಅದು ಪೇನ್ ಸಿಗ್ನಲ್ಸ್ ಬ್ಲಾಕ್ ಆಗುತ್ತೆ ಅಂತ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಯುವರ್ ಅಟೆನ್ಷನ್ ಗೆಟ್ಸ್ ಡೈವರ್ಟೆಡ್ ಫ್ರಮ್ ದ ಪೇನ್. ಇಸ್ ಇಟ್? ಯು ವಿಲ್ ಬಿ ಬಿಸಿ ಇನ್ ಪ್ರೊಸೆಸಿಂಗ್ ದಟ್ ಮ್ಯೂಸಿಕ್. ಅದೇನು ಹಾಡ್ತಿದ್ದಾರೆ, AR ರೆಹಮಾನ್ ಹಾಡು ಬರ್ತಾ ಇದೆ, ಚೆನ್ನಾಗಿದೆ. ಯು ವಿಲ್ ಬಿ ಇಮರ್ಸ್ಡ್ ಇನ್ ದಟ್ ಸೊ ದಟ್ ಯು ವಿಲ್ ನಾಟ್ ರಿಯಲೈಸ್ ಆಸ್ ಮಚ್ ಪೇನ್ ಅಂತ. ಸೊ ಅಂಡ್ ಈವನ್ ದೇ ಹ್ಯಾವ್ ಕಂಡಕ್ಟೆಡ್ ಸ್ಟಡೀಸ್ ಟು ಸಿ ದಿಸ್ ಇನ್ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಸ್ ಅಂಡ್ ಈವನ್ ದಿಸ್ ಲೇಬರ್ ಪೇನ್, ಇದಕ್ಕೆಲ್ಲ ನೋಡಿದ್ದಾರೆ. And this Richard and Merrill, they have done a survey, review of literature. It's a large review of literature. So, what they reported is listening to soothing, pleasant music with a slow tempo can reduce pain. See, just imagine, tale tumba novutiddaga, you will not listen something dabba 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 yaru kelala, like. So if you listen to something soothing, something relaxing, something that doesn't have too much of beats and all, it's relaxing, it's analgesic. It will push you into sleep. So people who listen to music, they require regularly, they require 50% less painkillers than those who don't. ಅಂತ ಹೇಳ್ತಾರೆ, ಸ್ಟಡೀಸ್ ಆರ್ ರಿಪೋರ್ಟೆಡ್. ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್ ಪ್ಲೀಸ್. ಸೊ ಹಿಯರ್ ವಿ ಕಮ್ ಟು ಮ್ಯೂಸಿಕ್ ಥೆರಪಿ. ವಾಟ್ ಈಸ್ ಇಟ್? ಹಿಯರ್ ದ ಡೆಫಿನೇಷನ್ ಇಸ್ ದೇರ್, and in this definition what we have to understand is it's evidence based. Evidence based andre we should have some evidence to prove, because music is an art. As I told in the beginning itself, its very purpose was not to give therapy, right? So adinda ನಾವು ಥೆರಪಿಗೆ ಅಳವಡಿಸ್ಕೋಬೇಕು ಅಂದ್ರೆ there should be some evidence that it works, right? So ಈಗ ಹಿಂದೆ ಏನು ಹೇಳಿದಾರೆ, ಆ ರಾಗ ಮಾಡಿದ್ರೆ ಇದಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ ಮಾತ್ರಕ್ಕೆ we need not believe it. It's evidence based. ಪುರಾಣ ಮಿತ್ಯೇವ ನ ಸಾಧು ಸರ್ವಂ ಅಂತ ಕಾಳಿದಾಸ ಹೇಳಿದಾಗೆ. Just because elders told, just because it's there in the granthas, it need not be true. We need not accept it without studying it. So adakoskara they have conducted studies and all, and it's evidence based approach, and it works on individualized goals. This holds good for all therapies, all psychotherapies, works on individualized goals. And it's a therapeutic relationship again. The only difference in other psychotherapy from other psychotherapies to music therapy is that it uses music in that therapeutic relationship. So music therapists, they are credentialed professionals. See, just because I am a musician, I can't claim that, wait, I'll give music therapy, come, I will give therapy. No, I should not do that, and I cannot do that. And people should not take therapies from people like that also. So you have to always go to a credentialed professional, a professional music therapist who has completed, who is certified to conduct music therapy. Next slide. So all these disorders can be helped. The next slide is not visible.
Ma'am, we can see the next slide, ma'am. Please continue.
Oh, okay, but it's not being displayed for me. That's okay.
Okay,
Now
ma'am.
it came. Yes. So all these disorders can be cured, like can be treated. Autism. See, this autism, it's one of the major areas in which most music therapy is effective. So, tumba studies agide, and it is successfully being practiced in this area of autism. Usually, autism makkalige enagutte andre, they will be having deficits in social skills and communication, basically. Social skills andre they don't maintain eye contact, all that. And also, for example, ಒಂದು ಮಗುನ ನಾನು ಪಾರ್ಕ್ ಕರ್ಕೊಂಡು ಹೋದ್ರೆ ಇನ್ನೊಂದು ಮಗು ಸ್ವಿಂಗ್ ಉಯ್ಯಾಲೆ ಮೇಲೆ ಕೂತ್ಕೊಂಡು ಆಡ್ತಿದ್ರೆ, this child should wait until that child gets down, right? ಬಟ್ ಈ ಆಟಿಸಮ್ ಇರೋ ಮಕ್ಕಳು ಏನ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ, ಈ ಮಗು ಆ ಮಗುನ್ ತಳ್ಬಿಟ್ಟು ಇದು ಹೋಗಿ ಕೂತ್ಕೊಳ್ಳುತ್ತೆ. ಪಾಪ ಇಟ್ ಡಸಂಟ್ ನೋ ದಟ್ ಇಟ್ಸ್ ರಾಂಗ್, ಇಟ್ಸ್ socially inappropriate ಅಂತ ಅದು ಗೊತ್ತಿರೋದಿಲ್ಲ. So for unknown reasons, these children with autism, autistic children, they react very well to music. They understand the language of music than the normal language very well. So what they do is they give music therapy. ಹೇಗೆ ಮಾಡ್ತಾರೆ, ಯಾವ್ಯಾವ ತರ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ, they will have all these instruments ಅಲ್ಲ, ಯೂಶಲಿ ಮ್ಯೂಸಿಕ್ ಥೆರಪಿ ಕ್ಲಿನಿಕ್ಸ್ ಅಲ್ಲಿ ಇರುತ್ತೆ, ಎಲ್ಲ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ಸ್ ಇಟ್ಟಿರ್ತಾರೆ ಅವರು. What the therapist does is, ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇದು ಈ ಟೇಕಿಂಗ್ ಟರ್ನ್ಸ್ ಹೇಳ್ಕೊಡ್ಬೇಕು ಅಂದ್ರೆ, ಒಂದು ಡ್ರಮ್ಸ್ ಇದಕ್ಕೂ ಇದ್ರ ಮಗು ಕೈಗೆ ಒಂದಷ್ಟು ಡ್ರಮ್ಸ್ ಕೊಡ್ತಾರೆ, ಆ ಥೆರಪಿಸ್ಟ್ ಒಂದಷ್ಟು ಇಟ್ಕೊತಾರೆ. ಥೆರಪಿಸ್ಟ್ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ಪ್ಲೇಯಿಂಗ್. ಆಗ ಅವ್ರು ಹೇಳ್ತಾರೆ, ನಾನು ನುಡಿಸಿ ನಿಲ್ಸೋವರೆಗೂ ನೀ ನುಡಿಸ್ಬಾರ್ದು, ನಾನಾದ್ಮೇಲೆ ನೀನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೇಕು. ಸೊ they will demonstrate and show the child how to take turns, so that it applies the same principles to its real life, daily life. And even this even this daily activities, right from wearing clothes to brushing teeth, everything they teach with small steps. It's called discrete trial training. ಒಂದೊಂದೊಂದೇ ಸ್ಟೆಪ್ಸ್ ಅಲ್ಲಿ ಇದನ್ನ ಒಂದು ಟಾಸ್ಕ್ ಇದ್ರೆ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಒಂದು ಹಲ್ಲು ಬ್ರಷ್ ಮಾಡೋದಿದ್ರೆ, ಅದು ಫಸ್ಟ್ ಬ್ರಷ್ನ ವಾಶ್ ಮಾಡೋದ್ರಿಂದ ಹಿಡಿದು ಪೇಸ್ಟ್ ಹಾಕಿ ಹಾಗೆ ಹೇಳ್ಕೊಡ್ತಾರೆ ಸ್ಟೆಪ್ ಬೈ ಸ್ಟೆಪ್. ಅಂಡ್ ಅದಕ್ಕೂ ಕೂಡ ದೇ ಯೂಸ್ ಮ್ಯೂಸಿಕ್ ಫಾರ್ ದಟ್. ಹೌ ದೇ ಡೂ ಅದನ್ನ ಟೆಕ್ನಿಕ್ಸ್ ಅಲ್ಲಿ ಐ ವಿಲ್ ಟೆಲ್ ಅಬೌಟ್ ದಟ್. ಅಂಡ್ ಈವನ್ ದಿಸ್ ಸ್ಟ್ರೆಸ್, ಆಂಗ್ಸೈಟಿ, ಡಿಪ್ರೆಷನ್, for all these disorders they use music. And music therapy is not used as whole and soul therapy. Adonde agi use madala. Usually they use it along with other therapies. They use it along with CBT, along with hypnosis, along with psychoanalysis, like that they use, or even along with the medications they use. It's used as a second line treatment. Next slide. These approaches, Yes, as I said earlier, they use it along with other therapies. Here, nodi ಇಲ್ಲಿ analytical music therapy. How they do here is it is mainly used for expression of unconscious thoughts. See, here comes Freud, uncle. And in psychoanalysis, what is the agenda? Here, we want to bring out all those unconscious thoughts, desires, whatever. The unconscious material should come into surface, right? For that, they use music. Hege, how do they do? They will ask the client to practice a dialogue within himself using music. ಆ ಥೆರಪಿಸ್ಟ್ ಜೊತೆ ಏನು ಬೇಡ, ಅವರಾಗ ಅವರೇನೆ ನಿಮಗೆ ನೀವೇ ಹಾಡುಗಳು ಕಂಪೋಸ್ ಮಾಡೋದು, ಹಾಡುಗಳು ಹಾಡೋದು, ಏನೋ ಒಂದು ಮಾಡಿಕೊಂಡು ಯೋರ್ ಥಾಟ್ಸ್ ಶುಡ್ ಕಮ್ ಇನ್ ಟು ಸರ್ಫೇಸ್. ಆ್ಯಂಡ್ ಲೇಟರ್ ದೇ ವಿಲ್ ಆಸ್ಕ್, ನಿಮಗೆ ಏನು ಅನ್ನಿಸ್ತು, ನಿಮಗೆ ಯಾವ್ಯಾವ ಥಾಟ್ಸ್ ಬಂತು ಅಂತ. ಲೈಕ್ ದಟ್ ದೇ ಡು. ಸೊ ಇಟ್ ಇಸ್ ದ ಕಾಂಬಿನೇಷನ್ ಆಫ್ music therapy and psychoanalysis. And this cognitive behavioral music therapy, again, it's the combination of cognitive behavioral therapy and music. In CBT, most of you would be knowing this. They work on structured sessions. They work in structured sessions and they work on modifying behaviors, thoughts and all. So here, this is done using music. Modifications of behavior. Usually, ಮಕ್ಕಳಿಗೆ ಇದನ್ನ ಜಾಸ್ತಿ ಮಾಡ್ತಾರೆ. They can modify children's behavior easily with the help of music. And then this community music therapy, it is rather than disorders, it is used in our ಈ ಭಜನ್ಸು ಸತ್ಸಂಗ ಎಲ್ಲ ಮಾಡ್ತಾರಲ್ಲ, it's an example of community music therapy. So all those aunties and ajis, papa, they will come and they will share all their worries, all their family problems, whatever problems they have. ಅದನ್ನೆಲ್ಲ ಎಲ್ಲರ ಹತ್ರ ಹಂಚ್ಕೋತಾರೆ, ಮಾಡ್ಕೋತಾರೆ. It's a community gathering. It's a social gathering. So there happens community music therapy. ಆ ಭಜನಲ್ಲಿ ಅವರು they will find some happiness. ಆ ಭಜನೆನ ಮಾಡ್ತಿದ್ರೆ they will find that okay, this is something good. I can come out of my depression. That feeling they get. So community music therapy, which happens in group settings, obviously. And in this creative music therapy, what they do is they play instruments and all so that they can bring their creativity out. Self-expression, it's very useful. So esto sala what happens to some people is that they have problems in understanding their selves at the first place. So ಅವ್ರಿಗೆ ಗೊತ್ತಿಲ್ಲ ಎಷ್ಟೊಂದು ಟ್ಯಾಲೆಂಟ್ಸ್ ಅವ್ರಿಗಿರುತ್ತೆ. So all those things can be brought out, should be brought out. So their selves should be expressed. That's where this creative music therapy comes. And in this Bhavani music therapy, it's not Indian, it's some Western technique. So that's why they have specified as classical music. So I'm really not sure that how they apply it in Indian classical music. I have neither seen nor experienced. So that technique where they use classical music for imaging, for imagery. It's a guided imagery technique. Yes, that's all. Next slide, please. Techniques. These techniques include what? Usually music therapies are ಏನೇನ್ ಮಾಡಿಸ್ತಾರೆ? Composing music. See, for that you need not be a composer, you need not be a musician. ನಿಮಗೆ ಹೇಗೆ ಬಂತು ಹಾಗೆ, so that your emotions come out ಅಂತ ಅಷ್ಟೇ. So composing, singing and playing instruments and writing songs and all. Lyric substitution is it's an interesting activity actually. ಇದರಲ್ಲಿ ಏನ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಾನು ಆಗ್ಲೇ ಕೊಟ್ನಲ್ಲ ಈ ಆಟಿಸಮ್ ಮಕ್ಳಿಗೆ ಮಾಡುವಂಥದ್ದು, ಅದ್ರಲ್ಲಿ ಏನ್ ಮಾಡ್ತಾರ ಅವರು, ಮಗುಗೆ ಎಲ್ಲಾ ಮಕ್ಳಿಗೂ ರೈಮ್ಸ್ ಬಂದೇ ಬರುತ್ತೆ. ಸೊ ಸಪೋಸ್ ಟ್ವಿಂಕಲ್ ಟ್ವಿಂಕಲ್ ಲಿಟಲ್ ಸ್ಟಾರ್ ಟ್ಯೂನ್ಗೆ ದೇ ವಿಲ್ ರೀಪ್ಲೇಸ್ ದಟ್ ಲಿರಿಕ್ಸ್, ಟ್ವಿಂಕಲ್ ಟ್ವಿಂಕಲ್ ಲಿಟಲ್ ಸ್ಟಾರ್ ಅಂತಿರೋದ್ರ ಬೇರೆ ಏನಕ್ಕೋ ಅವ್ರು ಏನ್ ಆಕ್ಟಿವಿಟಿನ ಟೀಚ್ ಮಾಡ್ಬೇಕು ಅಂತಿದಾರೋ ಅದಕ್ಕೆ they will substitute, they will replace. For example, brush your teeth every day, put the paste on the brush, ಆ ಥರ ಏನೋ ಮಾಡ್ತಾರೆ, like that. ಹಾಗೆ ಲಿರಿಕ್ ಸಬ್ಸ್ಟಿಟ್ಯೂಷನ್ ಫಾರ್ ಅಡಲ್ಟ್ಸ್ ಆಲ್ಸೋ ಇಫ್ ದೇ ಹ್ಯಾವ್ ಸಮ್ ಪ್ರಾಬ್ಲಮ್ ಇನ್ ಸೆಲ್ಫ್ ಎಕ್ಸ್ಪ್ರೆಷನ್ ಆರ್ ಈವನ್ ಇಫ್ ಸಮ್ ಆಂಗ್ಸೈಟಿ ಏನೋ ಇದ್ರೆ ನಿಮ್ಮ ಇಶ್ಯೂಸ್ನ ಹಾಕಿ ಯಾವುದೋ ಒಂದು ಒಳ್ಳೆ ಹಾಡಿಗೆ ದೇ ವಿಲ್ ರೀಪ್ಲೇಸ್ ದ ಲಿರಿಕ್ಸ್. ದಟ್ ಈಸ್ ಲಿರಿಕ್ ಸಬ್ಸ್ಟಿಟ್ಯೂಷನ್. And this listening to recorded or live music, it's there. Usually recorded ಮಾಡ್ತಾರೆ ಇವಾಗೆಲ್ಲ live music ಗಿಂತ. Live music it will be there in active music therapy sessions where uh, the client and therapist both are involved. In passive music sessions where there is only listening, they use this recorded sessions, recorded music. Next. So there are, of course, misconceptions. See, the very first thing is I have already made clear. Just because a person is musician, he need not be a music therapist. ಇನ್ನೊಂದು ಹೇಳ್ಬೇಕಂದ್ರೆ ಆಕ್ಚುಲ್ ಆಗಿ ಹೇಳ್ಬೇಕಂದ್ರೆ ಫಾರ್ ಅ ಮ್ಯೂಸಿಕ್ ಥೆರಪಿ ಫಾರ್ ಅ ಮ್ಯೂಸಿಷಿಯನ್ ಇಟ್ ಈಸ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್ ಟು ಅಕ್ಸೆಪ್ಟ್ music as something therapeutic because his mind will be always in music is for performing teaching ಈ ತರ ಇದ್ರಲ್ಲಿ ಇರುತ್ತೆ ಹೊರತಾಗಿ ಥೆರಪ್ಯೂಟಿಕ್ ಬರೋದು ಸ್ವಲ್ಪ ಕಷ್ಟನೇ. And if you even on a lighter note, if you want to treat a musician who has some mental disorder or something using music therapy, you can't treat because ಅವ್ರದ್ದು ಆ ಮೈಂಡ್ ಅಲ್ಲಿ ಥೆರಪಿ ಕಡೆ ಬರೋದೇ ಇಲ್ಲ. ಇಫ್ ಯು ಮೇಕ್ ಹಿಮ್ ಲಿಸನ್ ಟು ಅ ರಾಗ, ಹಿ ವಿಲ್ ಬಿ ಮೋರ್ ಕಾನ್ಸಂಟ್ರೇಟಿಂಗ್ ಆನ್ ಇದು ಈ ಸಂಗತಿ ಹೇಗ್ ಬರ್ತಾ ಇದೆ, ಗಮಕ ಹೇಗ್ ಕೊಡ್ತಾ ಇದ್ದಾರೆ, ಚೆನ್ನಾಗಿ ಬರ್ತಾ ಇದೆಯಾ. ಹಿ ವಿಲ್ ಬಿ ಆಲ್ವೇಸ್, ಹಿ ಆರ್ ಶಿ ವಿಲ್ ಬಿ ಕಾನ್ಸಂಟ್ರೇಟಿಂಗ್ ದಟ್. ಥೆರಪಿ ವರ್ಕೌಟ್ ಆಗೋದೇ ಇಲ್ಲ ಅಲ್ಲಿ. ಸೊ and another thing is that this also I made it clear, to get music therapy, to receive music therapy, you need not be a musician or you need not know how to sing. Ayyo nange haadak baralla, that's okay, they will teach you. Like there, as I said, it's not for entertainment or something, it's for therapy. So the client need not know. And this, yes, of course, ragas have the properties of the curative properties, medicinal properties, therapeutic properties. Yes, they do. But these specific raga cure specific disorders, like it's little difficult because, see, you can manage pain, but you can't cure. Music therapy largely works on the symptoms, not on the cause of the disorder. So the problem of relapse is also high, and you can, at the first place, you can't cure things, you can manage things, you can get relief. But there are people, I don't deny, but there are people say ಈ ರಾಗ ಹಾಡ್ಬಿಟ್ರೆ ಪೂರ್ತಿ ಹೊಟ್ಟೋಗುತ್ತೆ ಡಿಸಾರ್ಡರ್. ಪೂರ್ತಿ ಹೋಗೋದು ಸ್ವಲ್ಪ ಕಷ್ಟ, I doubt. We can manage. Next slide. So we have come to the end of this presentation, and yes, it is a very promising field where lack of awareness is there. Like how all psychologists, they will be knowing about cognitive behavioral therapy, they will be knowing about gestalt therapy, NLP, everything, but music therapy is not very as popular as those. ತುಂಬಾ ಅವೇರ್ನೆಸ್ ಬರಬೇಕಾಗಿದೆ, ತುಂಬಾ ರಿಸರ್ಚ್ ಕೂಡ ನಡಿಬೇಕಾಗಿದೆ, ಕಲ್ಚರಲಿ ಓರಿಯೆಂಟೆಡ್ ರಿಸರ್ಚ್. ಸಿ, ಮ್ಯೂಸಿಕ್ ಇಸ್ ಯೂನಿವರ್ಸಲ್, ಅದು ಯಾರು ಇಲ್ಲ ಅನ್ನಕ್ಕಾಗಲ್ಲ. ಬಟ್ ದ ನ್ಯೂಆನ್ಸಸ್ ಆಫ್ ಇಂಡಿಯನ್ ಮ್ಯೂಸಿಕ್ ಇಸ್ ಲಿಮಿಟೆಡ್ ಟು ಇಂಡಿಯಾ, ಅಂಡ್ ದ ನ್ಯೂಆನ್ಸಸ್ ಆಫ್ ವೆಸ್ಟರ್ನ್ ಮ್ಯೂಸಿಕ್ ಇಸ್ ರಿಲೇಟೆಡ್ ಟು ದೇರ್ ಕಂಟ್ರಿ. ಅದನ್ನ ನಾವು ಇಲ್ಲಿ ಅಪ್ಲೈ ಮಾಡೋದು ಸ್ವಲ್ಪ ಕಷ್ಟ ಆಗುತ್ತೆ. ಸೊ ದ ಲಿಟ್ರೇಚರ್ ಆಫ್ ಇಂಡಿಯನ್ ಮ್ಯೂಸಿಕ್ ಇಟ್ ಸೆಲ್ಫ್ ಇಸ್ ವೆರಿ ರಿಚ್. There is very high scope for research in this particular area, and in IMHANS they are really doing a very good job. Dr. Shantala Hegde ma'am, she is working very much on this. In fact, I was reading her article where she had tried applying music therapy for patients with schizophrenia, patients with Alzheimer's and all. And for patients with schizophrenia, yes, all those secondary symptoms like negative mood, negative affect, and flattened emotions, all those music therapy had an effect on all those things, it seems. So, and there are many neuroimaging studies where they conduct EEG, where they take EEG readings and all. And the fruitful result have come, and there are many more research required in this field. Technology assisted, yes, everything is technology assisted now. Right from the webinar to everything is technology assisted. So this will also shortly be technology assisted. And I thank, firstly, I thank giving for calling me for this webinar, for inviting me, and the principal ma'am for giving me an opportunity to share what little things I knew in this field. So now the session is open for questions. If you have anything to ask, please unmute yourselves and ask.
Kaladhari ma'am, a few questions that were asked during the registration. I'll read them out.
Okay.
So I think you can look upon it. So
Yes.
there's one participant who has asked, I would like to do my dissertation for my master's in application of Carnatic ragas for anxiety, that is through music, passive music therapy. Can you give me some suggestions on this and things I need to take care while doing the same?
Yes, it's a very good topic. Whoever the participants, congratulations to him or her. It's a very good topic for research. And for this, you have to go for an intervention study where you will have again this experimental group, control group. Like you will get real human participants and make this study. So one suggestion is that you just please go for some articles, study articles where they have already studied this anxiety and all. If you want to study anxiety, which ragas they have already used, so which raga has yielded results. So take that and carefully choose your population, like on whom you want to study. Do you want to study on children or on adults, or on adults with specific problems, some problems, or normal adults, or a clinical population? You have to define your population also. And another thing you have to keep in mind, you have to take care of that is what I have explained so much about the emotions that they elicit and all, right? So please choose the compositions or the clips that you play for your participants very carefully, because the clip you might play in the audio that you play for them might not sending the proper message, or might not be eliciting the emotions that you want it to happen. Ulta ಆಗ್ಬೋದಲ್ಲಿ. So there, as much as possible, choose instrumental music, because instrumental musically the you can, you know, the extraneous variable part will be ಸ್ವಲ್ಪ ಕಡಿಮೆ ಆಗುತ್ತೆ. Because if you choose human voice only, their tone, the texture of the voice, timbre of the voice and all comes. So it's better if you take instrumental music. Hope your question is answered.
Okay, ma'am, there's another question. Which type of music or genre do you think relaxes the mind?
Yeah, genre is up to you, because genre preference, it's personalized. It's personal to everyone. So you might like classical, or you might like something like music, or you might like film music. So genre you can choose. It will be of your choice. But for relaxing, it's better if you choose something which is slow paced, which has that melodious rendering, presentation, something slow, something pleasant would be opt for relaxing.
Okay, ma'am. Anupama, ma'am, you have a question, you can unmute and ask.
Ma'am, what is the criteria to be a music therapist?
Yes, you have to complete the music therapy course. In India, you have this Chennai School of Music Therapy is one, and there might be other schools also. I don't know much, but this Chennai one is quite popular one. And in foreign countries, you have many. You have Berkeley School of Music, London School of Music, all those. You can you have to do a course with that. You have PG diploma course and you have certification course. And in foreign countries you have masters itself, like we have MSc, you have that. So with that certification and internship, you can become a music therapist.
Okay, ma'am. Thank you.
Hello, ma'am.
Yes.
Uh,
Hello.
Thank you for a beautiful presentation.
Thank
And
you.
it is very nice to see that two integrated approach, that one is psychology and music. So like this, the psychology, the field will, enhance by bringing up all these different fields. And
Definitely.
I have got one thing to say, that in Bharatanatyam and also in Kuchipudi,
Hmm.
there is an item called Shabdam,
Hmm.
where the initial jatis were
Hmm.
taken from when frog was, the sound of frog, you know,
Huh.
those were taken and the jetties were constructed. So if
Huh.
our elder says that, ಏನ್ ಕಪ್ಪೆ ತರ ಒಟ್ಟುಗುಡ್ತೀಯ ಅಂತ, if they ask, there
Uh-huh.
is already our elders have brought some meaning for ಕಪ್ಪೆ
Yes.
ತರ ಒಟ್ಟುಗುಡ್ತೀಯ ಅನ್ನೋದಕ್ಕೂ. And
Hmm.
also this, you also told this music cognition lab was set up at Nimhans
Yes. Yes.
by Dr. B.N. Gangadhar sir, and also the Shantala Hegde madam.
Yes.
And they have
Yes.
done a lot of research work. But my question is, madam, like Alzheimer's disease, Parkinson, and specific learning disability among children, if they
Hmm.
have got, spelling disability and reading
Uh-huh.
disability, especially, this music
Huh.
therapy will help. And also different kinds of brain injuries and these uh, uh, procedures,
Huh.
epilepsy and everything. But my question is, which
Hmm.
raga will help for which kind of mental illness? Is there anything like that, madam?
That's what. Madam, they say that this raga usually, for example, they say that listening to Darbari, there is one raga called Darbari. We call it
Okay,
Carnatic classical ಅಲ್ಲಿ Darbari Kannada ಅಂತ ಹೇಳ್ತೀವಿ.
okay,
ಅದನ್ನ ಕೇಳೋದ್ರಿಂದ ಮೆಮೊರಿ ಇಂಪ್ರೂವ್ ಆಗುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಅಂಡ್ ಈವನ್
okay,
ಇನ್ಸಾಮ್ನಿಯಾ ಹೋಗುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರೆ.
okay,
ಸೊ ಅದು ಪ್ರಾಕ್ಟಿಕಲ್ ಆಗಿ ಎಷ್ಟರ ಮಟ್ಟಿಗೆ ಆಗುತ್ತೆ ಅನ್ನೋದನ್ನ ತುಂಬಾ ಟೆಸ್ಟ್ ಮಾಡಿ ನೋಡ್ಬೇಕು. ಬಿಕಾಸ್ ಈವನ್ ಇನ್ ಟೆಸ್ಟಿಂಗ್ ದೇ ಹ್ಯಾವ್ ಸೀನ್ ಲೈಕ್
mm,
ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಸಿಇಜಿ ರೆಕಾರ್ಡ್ಸ್ ತಗೊಂಡಿದ್ದಾರೆ.
okay,
ಸ್ಲೀಪ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಸ್ಲೀಪ್ ಹೇಗಾಗುತ್ತೆ ಅಂತ ದೇ ಹ್ಯಾವ್ ಚೆಕ್ ದ ಬ್ರೈನ್ ವೇವ್ಸ್ ವಿಚ್
okay,
ಆರ್ ಡ್ಯೂರಿಂಗ್ ಸ್ಲೀಪ್ ಹೇಗಿರುತ್ತೆ ಅಂತ. But they are not able to come out with the proper explanation for that. ಹೇಗ್
mm,
ಆಗ್ತಾ ಇದೆ ಅದು ಅಂತ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ. ಸೊ is it the raga that is causing the effect, or
mm,
is there something else along with it ಅಂತ? ಅದು
okay,
ಎಕ್ಸ್ಟ್ರೇನಿಯಸ್ ವೇರಿಯೇಬಲ್ಸ್ ಇಂದ ಆಗ್ತಾ ಇದೆಯಾ ಅಥವಾ ಬರೀ ರಾಗದಿಂದಾನೇ ಆಗ್ತಾ ಇದೆಯಾ ಅನ್ನೋದು, ಅದು ಸ್ಟಡಿಗಳಿಗೂ ತುಂಬಾ ಆಗ್ಬೇಕಾಗಿದೆ. ಹೇಳ್ತಾರೆ ಇವಾಗ ದೇ ಆರ್ ಯೂಸಿಂಗ್ ಈ ಬ್ಯಾಂಗ್ಳೂರಲ್ಲೇ ಐ ಫರ್ಗಾಟ್ ದ ಸೆಂಟರ್ಸ್ ನೇಮ್. ಅಲ್ಲಿ ದೇ ಹ್ಯಾವ್ ಸೆಡ್, ಇವಾಗ ಮೊನ್ನೆನೂ ಕನ್ನಡ ಪ್ರಭಾದಲ್ಲಿ ಬಂದಿತ್ತು ಈ ರಾಗ ಸ್ಕಿಜೋಫ್ರೀನಿಯಾಗೆ ಯಾವ ರಾಗ ಮತ್ತೆ ಡಿಪ್ರೆಷನ್ಗೆ ಯಾವ ರಾಗ
mm,
ಅಂತ ಎಲ್ಲ.
okay,
ಬಟ್ ಅದು ಎಷ್ಟು ಮಟ್ಟಿಗೆ ವರ್ಕೌಟ್ ಆಗುತ್ತೆ ಅನ್ನೋದು ಇಟ್ಸ್ ಅದು ಪೂರ್ತಿ ನಾವು ಇದಕ್ಕೆ ಇದೇನೆ ಅಂತ ಹೇಳಕ್ ಆಗೋದಿಲ್ಲ ಬೇರೆ
oh,
ಥೆರಪಿಗಳು ಹೇಳೋ ಹಾಗೆ.
okay. Okay, okay. And also the initially what we use JPMR, Jacobson Progressive Muscular Relaxation.
ಹಾ
There is a
ಹಾ.
particular rhythm is there to present that. Then
ಎಸ್
only the entire body will get relaxed.
ಎಸ್.
So even our Western culture also accepted that. So we are
Yes.
very slow, and we should start doing this because already movement therapy is already, slowly it is stepping inside. And even
Yes.
music therapy also comes. It will be very nice. Thank you, madam. Thank you for your
Thank
valuable
you,
time.
ma'am.
And
Thank you,
so,
ma'am. Thank you.
thank you.
Thank
Deepa ma'am, you have a question?
Thank you. First of all, at the outset, I would like to congratulate you, Kaladhari ma'am. It was
thank
very
you, ma'am.
extremely informative, and I
Thank
really enjoyed the session. I have a question. I have
Yes.
a teenage daughter who listens to Conan Gray, and that kind of music. I
Hmm.
feel that the lyrics by themselves, like you rightly mentioned, the
Hmm.
lyrics by themselves are so depressive.
Ah.
No, I have heard a couple of times, and it
Hmm.
really concerns me. When I listen to the lyrics and when I listen to the songs,
Hmm.
um, won't they cause some kind of depression? And you know how the teenage years are very, I
Yes.
mean, teenagers are very vulnerable to,
Yes.
emotions. They won't be in control. I don't know.
Yes.
I just want to wean her away from such songs. But she says that she enjoys them. As a parent, it's a bit of a concern for me. How do I
Okay.
go about?
Yes, ma'am. It's better if you find a proper reason why she is liking it, because there is a tendency that if you are
Hmm.
sad, you tend to listen to a sad music itself. It's not ulta like I am sad, so I will listen to happy mode. No, if I am sad, usually if you observe within yourselves, it happens. ಬೇಜಾರಲ್ಲಿದ್ದಾಗ we will be again going further diving into that depression. So
Mm-hmm.
why that lyrics, or is that lyrics that is making her to like that, or is it the tune? Adu why she is liking that, it's better if you find the reason first, so that
Okay.
you can, if it's not healthy, if it's not something a healthy sign, so you can slowly give her some alternative which she likes, like some alternative genre, so that you can take her away from that such lyrics or such tunes.
Okay, okay. But when I ask her, she says that she doesn't, attach any emotional importance to that. It's just that she
Huh.
likes such kind of songs. It is
Huh.
not just her. I have noticed this in, many of my students also. They have
Huh.
a, fascination for a particular musical band.
Yeah.
I
Yes.
don't understand. Maybe I'm an aged person, so I don't know.
No, if she's not attaching any emotional aspects to that, or if she's not emotionally attached, then it's fine. That's okay.
Okay, okay. Thank you so much. Thanks a lot.
Thank you, ma'am.
Does anybody else have any questions? Yes, Gagan.
Um, Good afternoon, ma'am.
Good afternoon.
So I have this question. Like people say, like when you're having a headache, you can listen to some soothing music or relaxation music. Is it true that if we listen to some particular soothing musics, our headaches will like if we have any pain in the head, it goes away? Is it true?
Yes.
Like, can it
Yes,
make?
yeah, yes. It can happen. It can definitely happen. You will get a kind of relief from the ache, from the headache. But for migraine, if it's very, severe as how it happens in migraine and all, then you will not be able to listen itself. As far as I know, migraine people. But for mild headache and all, it definitely does work.
Yes, ma'am. Thank you.
Thank you.
Yes, Harshita, you can ask your question.
Good afternoon, ma'am.
Good afternoon.
Some people tell, so what type of song we listen, we become like that. For example, if we listen to sad songs, always we'll be sad. Or if you listen to happy songs, always you will be happy. Is it true?
Yeah, to some extent true. Like again, it depends on how much you're attached to that song. if you are listening it just for a fun, like just for time pass, if you are doing, or if you are attached with that lyrics, or if you are too much, if the song is very, the tune is very, sad kind, and if you are enjoying it because it's in the sad mode, then you will tend to be sad, and all you will tend to be further sadder. It's true in some cases.
Ma'am, why some people are not inclined to music? Like some people don't listen to music at all. Is there some psychological thing in them that makes them not listen to music?
See, we have saying that loko bhinna ruchihi, like everyone's taste, everyone's aesthetic sense, everyone's interest is different, right? So that person, he or she might not like music. They don't have that interest, that taste in music. So you can't help it there. For this, I don't know if we can find a particular reason, psychological reason. They just are not interested. Like how we are not interested. I am not interested in drawing. I am not interested in sports. Like that, they are not interested in music. That's all.
Okay.
Does anybody else have any question?
Hello, ma'am. This is Karthik. And
Hello.
Yes.
yes, ma'am. I don't have any question. I just wanted to congratulate you, ma'am. And because it is the one of the beautiful webinar which I have ever attended, and the
Thank you
beauty
so
of
much.
the beauty of music, which is relating to our cognitive thing, is itself awesome, ma'am. And and the webinar is awesome, ma'am.
Sure.
I have just enjoyed it, ma'am.
Thank you so much. And if you are interested to further read about it, know about it, I have few very interesting articles.
Okay.
So I will forward those links to Jayant sir or Geeta ma'am, so that
Okay,
you
ma'am.
can collect it from them.
Okay, ma'am. Thank you. Thank you.
I would request Giant sir to propose the vote of thanks.
Thank you, Geeta ma'am. So it's my immense pleasure to give vote of thanks. ತ್ಯಾಗರಾಜರು ಹೇಳ್ದಂಗೆ ಎಂದರೋ ಮಹಾನುಭಾವು ಅಂದರೀಕಿ ವಂದನಮು ಅಂತ ಹೇಳ್ದಾಗೆ ಐ ಆಮ್ ವೆರಿ ಹ್ಯಾಪಿ ಟು ಥ್ಯಾಂಕ್ ಅವರ್ ಗೆಸ್ಟ್ ಸ್ಪೀಕರ್ ಫಾರ್ ದ ಡೇ, ಮಿಸ್ ಕಲಾಧರಿ ಭವಾನಿ, ಸಾರಿ ವಿದುಷಿ ಕಲಾಧರಿ ಭವಾನಿ. ಶಿ ಹ್ಯಾಸ್ ನನಗೆ ಏನಂತಾರೆ ಅದಕ್ಕೆ ನನಗೆ ಏನ್ ಮಾತಾಡಬೇಕು ನನಗೆ ಗೊತ್ತಾಗ್ತಿಲ್ಲ. ಶಿ ಹ್ಯಾಸ್ ಮೇಡ್ ದ ಸೆಷನ್ ಸೋ ಬ್ಯೂಟಿಫುಲ್ ದಟ್ ಐ ಆಮ್ ಟೋಟಲಿ ಇನ್ ದಟ್ ಫ್ಲೋ ಆಫ್ ದಟ್ ಸೆಷನ್ ಅಲ್ಲೇ ಇದ್ದೀನಿ ನಾನು ಅಂತ ಹೇಳಿದಾಗ ಐ ಕೆನಾಟ್ ಏನ್ ಥಾಟ್ಸ್ ನಂಗೆ ಬರ್ತಿಲ್ಲ ಇವಾಗ ಏನ್ ಮಾತಾಡಬೇಕು ಅಂತ. ಥ್ಯಾಂಕ್ ಯು ಮ್ಯಾಮ್ ಫಾರ್ ಸಚ್ ಎ ವಂಡರ್ಫುಲ್ ಸೆಷನ್, and I would like to thank Kaladhari ma'am for her wonderful session, and I would also thank our Geeta ma'am for giving us an opportunity to arrange this webinar in our college. And also I would like to, not but not the least, I would like to thank our principal ma'am also for giving opportunity to arrange this webinar and make this a grand success. And also, without you participant, this webinar would not be a grand success. I would like to thank all the participants who had attended this webinar and made this webinar a grand success. Thank you all. And I would like to make this point that in chat box, the feedback link is being shared. You can please fill the feedback form and get your certificates of this webinar. Thank you once again for the guest speaker and all the participants for making this session a grand success. Thank you.
And thank you, Jayant sir, for organizing. And it was a very well organized webinar. I had a very good experience with all of you. And I'm really honored, humbled by your words. Thank you so much.
Thank you, ma'am.